and welcome to the Mental Health Program brought to you by Hope Channel Kenya and myself, Florida Afifu. I am a clinical psychologist and I am glad to bring you this program which furnishes you with information for awareness on issues of mental health and also for promotion of good mental health. We have been tackling different topics on issues mental health in the past 9 episodes. Today makes our 10th, and we know that you probably have questions or personal consultations that you'd want to be addressed. We invite you to type in your questions on the chat box of this particular video, and if you have personal consultations, feel free to reach to us on the email address that is displayed on your screen. Last week, we talked about drug addictions, and we learned that these are addictions related to long use of psychoactive substances or other substances that have the ability to activate the reward pathway of our brain. The reward pathway of our brain is the part of the brain that causes us a feeling of satisfaction, a feeling of joy and happiness when we accomplish a goal or when we engage in activities that we enjoy. This reward pathway is supposed to naturally be activated by such activities or such feelings. However, psychoactive substances that end up causing addictions are the ones that are responsible for activating the reward pathway chemically, resulting into addictions. Drug addictions, as we understood last week, are addictions or that involve a pathological pattern of use where an individual uses the drug even more regardless of the consequences that they experience. We also considered the stages of addiction that explain how drug use develops into addiction. We considered the symptoms of addiction, causes of addiction, the effects of addiction on the person that is addicted and on the family and the society at large. And finally, we were able to consider the treatment options that are available for drug addictions. Before we move on our topic of discussion today, let me put a little bit of more emphasis on the effects of drug addictions to the family. Awareness on how drug addictions affect the family is important in helping the family to identify the wrong coping mechanisms and do away with them. It's also important to help the family develop proper and productive coping behaviors and also be able to prevent the tension and the conflict that may come to the family as a result of the addictive behavior. Finally, when the family is more aware on how they are affected by the drug addiction and their response to the drug addiction, then they are able to come together and stage intervention and support the treatment of their kin that is suffering drug addiction. Family systems and individual members of the family are adversely affected by drug addiction. These effects go beyond just the person that is addicted to a particular drug, but to the entire family. Drug addiction causes considerable amount of emotional burden to members of the family. Most of the time, members struggle with feelings of anger. Sometimes it is anger to yourself as a parent or as a sibling, feeling anger in the sense that you probably feel that you had responsibility to play to prevent addiction occurring in your family and you did not. Sometimes it is anger towards the person who is addicted based on the behaviors that they exhibit during the intoxication. Other times it's just anger that is directed to self. There's also anxiety. People with drug addictions often use drugs in situations which are potentially dangerous. And most of the time we find ourselves worrying about their welfare, worrying about their safety wherever they are, worrying about their health. And this can bring a lot of anxiety to the family, to individuals within the family, and even to the person himself. There's also shame and guilt that is associated with the drug addiction. People suffering drug addictions under intoxication, most often than not, they lose inhibition and engage in behaviors that may bring embarrassment and shame to the family. The emotional burden that is experienced by members of the family and the individual that is suffering addiction often brings considerable tension and conflict within the family. Family instability may result as a result of the emotional burden and the tension and the conflict in the relationships within the family. And as a result, we may have separations, we may have other consequences that affect the family members to a great deal. And so as a family, you may be going through other family problems that are not, you may not necessarily associate with the drug addictions, but chances are that the dynamics that are at play in terms of relationships, the emotions, and the process of engaging within the family setup are associated with the drug addiction. Therefore, it is important that as a family, if you have a member that is suffering drug addictions, it is very, very important that you seek support from mental health experts so that the family is taught and empowered with skills to cope better and to be able to provide better support to the person who is suffering drug addiction. The good news about drug addictions is that there is treatment, and if the family unites together and with the individual who is suffering addiction, if he consents and proves that he needs help, then treatment can be found and the member can be restored back to full health. So is the possibility of the family relationships to be made better through therapy. Today we want to look at another form of addiction, and that is behavioral addictions. And to start us on our topic today, let us consider the case of a person we may refer to as patient A. Patient A is admitted in hospital in a critical condition after attempting suicide by means of by ingesting a cleaning agent at the place of work. His injuries are severe, marked with burns in his throat and also considerable damage in the linings of his stomach. He is intubated for a couple of days as he remains unconscious. Eventually, he regains consciousness and is referred to mental health department for mental health assessment, as is the practice with any suicidal attempts. Unable to talk much due to his injuries, he gives a brief explanation as to what happened and why he tried to kill himself. And patient A explains that he is in a lot of financial burden, he is in a lot of debt. And what triggered his erratic action and or what caused him to ingest poison is because he found himself in a lot of bad debt, not only to his family or friends, but also debt of monies that he used that do not belong to him, other monies that belong to his workplace. Corroborative history by patient A's wife reveals that patient A has a problem with gambling. He gambles a lot most of the time, spending family money and going on to seek for debts in order to sustain his gambling behavior. When patient A receives his salary, he portions it according to his needs for the month, paying his rent, remaining with what he needs for transport and out-of-pocket money, and giving his wife money for daily upkeep for the family. But a few days later, patient A would come back to his wife and demand for the money that he had given for upkeep, which he ends up using for his gambling behavior. When patient A runs out of money, or when he doesn't have money to sustain his gambling behavior, patient A becomes irritable, very anxious, showing signs of psychomotor agitation. He's unable to sleep, and other times he even becomes verbally and physically aggressive. Due to his inability to control his behavior, patient A has accumulated a lot of debts, monies that he uses to sustain his gambling behavior. The night preceding the event where he tried to kill himself, patient A gambled all the money that he had and lost money that belonged to his landlord, because he is also a caretaker of the plot where they stay. And he also gambled away all the money that he had been given from his office to buy detergents for work the next day. And so when patient A realizes the difficult situation that he has brought himself into as a result of his gambling behavior, coupled with the depression that sets in as a result of the anxieties and the behavior that he seems to be addicted to, patient A impulsively decides that it's time to kill himself. He feels that he has no control over his life. He feels that he has brought himself into a huge debt situation, and he feels that he has no control over his gambling behavior. And coupled with his depression, patient A decides that he needs to end his life. This is a perfect case to introduce us to the situation of behavior addictions. There was a time when addictions primarily referred to dependency on drugs. But the word now has a broader meaning, covering thinking and behavior which is habitual, repetitive, and very difficult to control regardless of the consequences that behavior brings us. Behavior addictions are behaviors that become compulsive and problematic, often characterized by a continuation of the same behavior even after it has brought severe negative consequences and impacts on that person. These impacts might show in the person's relationship, in their work, or even in their physical and mental health. Part of the reason why people continue in behaviors even after they become detrimental to their lives is explained by the brain chemical dopamine. Dopamine is largely responsible for the high that we feel when we take in psychoactive substances, or the high that we feel as a response of engaging in certain behaviors. Almost all the behaviors that are considered to be addictive are found to have qualities that are believed to cause the release of dopamine. Dopamine creates a strong reward pathway in the brain in response to a specific drug or a behavior, and for that reason that behavior or the use of that specific drug becomes very difficult to stop. While there's only one formally recognized behavior addiction, research has proven that there are other behaviors that are also found to be addictive. Gambling is medically recognized as an addictive behavior and is referred to in medical terms as gambling disorder. Some other behaviors that are addictive are behaviors such as sex. We have sex addiction, addictions to pornography, addictions to masturbation, internet and mobile use addictions, social media addiction, and food addiction. The symptoms of behavioral addictions mirror those of substance use addictions. And these symptoms include the need to use more of the behavior than is intended or longer than was intended. When one is addicted to a particular behavior, when they get to the point of addiction, there is usually the need or the inability to determine how long or how much of the behavior a person would engage in. Another symptom is a strong desire to cut back on the behavior, but totally unable to do so. A person who is addicted to a particular behavior spends more time in engaging in such behavior, obtaining the use of that particular behavior, using it, or most of the time spends more time recovering from the effects of the particular behavior of addiction. There are strong cravings and urges to engage in the behavior. There is recurrent use of the behavior that interferes with fulfillment of major responsibility or major role obligations of the individual in the family setup, at the workplace, or even in school. There is persistent use of behavior despite experiencing problems that occur as a result of the use of that behavior. An individual who is addicted to a particular behavior may not be able to stop. They will continue using that behavior regardless of how it affects them in their relationships, how it affects their family, or even how it affects their health and their mental health. When a person addicted to a particular behavior tries to withdraw or reduce indulgence in the behavior, then they suffer withdrawal symptoms similar to that of patient A, where they are anxious, they show signs of psychomotor agitation, they are irritable, easily angered, where they are aggressive, either verbally or where they are aggressive physically to the people around them, And other times, they may fall into depression or have signs of anxiety as a withdrawal from a particular behavior. It is important to note that a person does not require to show all these symptoms at once to indicate that they are struggling with behavior addiction. Anyone describing 2 or more of the above symptoms could be struggling with behavior addictions. Other signs and symptoms of behavior addictions include efforts to hide the behavior or how often the person engages in the behavior from his friends. They are ashamed about the behavior, or they know very well that the behavior is problematic. Therefore, they would try as much as possible to hide that behavior and its effect from their friends and their families. Another symptom is feeling an inability to resist the urges to engage in that behavior, relying on the behavior to release stress or to cope with difficult life situations, becoming defensive when they are questioned about the behavior, experiencing excessive guilt after engaging in that particular behavior of addiction. Sometimes they would make promises to stop but fail each and every time. They become moody, irritable, upset, or angry when they are unable to engage in the behavior. Gambling disorder has more specific symptoms that are specific to gambling patterns, such as chasing losses. One who is addicted to gambling would chase the losses that they make in the event that they gamble and lose. They will always have this strong feeling, this strong conviction that when they put higher bets or when they continue gambling, they'll be able to win back their losses. Another symptom specific to gambling behavior is placing higher and riskier bets. Whenever they win, they get a satisfaction. The dopamine rush brings the joy and the thrill for the moment, and there is always the feeling that when they place higher bets, they will win more and they'll be able to feel more of the thrill and the dopamine rush that comes with the behavior. People struggling with gambling addiction also have a problematic pattern of borrowing money that puts them in high amount of debts, such as in the case of patient A that we had considered as we were starting on our discussion today. So what causes behavioral addictions? No one cause explains why some people develop compulsive or addictive tendency, although there are different social, biological, and psychological factors that make some people more vulnerable to them. A family history of addictions or mental health issues is a predisposing factor. People coming from families where there have been history of behavioral addictions or any form of addiction are more predisposed or have higher risks of developing addictions, even behavioral addictions. Mental health issues have a comorbid nature with most addictions, and therefore an individual who has diagnosed mental health conditions is at a higher risk of developing addictions of behavior and other addictions. Of course, behavioral patterns and personal choices also influence a person's risk. In order for one to become addictive in a particular behavior, they need to have engaged in that behavior more than once for them to become addicted to that particular behavior. Use of the behavior as a coping mechanism or as a way of dealing with difficult emotions is also a predisposing factor. When one uses a behavior to run away from the realities of their problems, to cope with their difficulties, then there are more chances of them using that behavior repetitively are higher, and so is the higher, the risk of them being addicted to the behavior is also heightened. Certain personality traits could also heighten a person's risks for developing addictive behavior. Research on drug and alcohol and even behavioral addiction suggests that people who are more impulsive and prone to risk-taking are more likely to develop addictions, that is drug addictions and behavioral addictions. So what are the effects of behavioral addictions? Addictions of behavior have effects similar to addictions in substances. The family is affected when somebody is addicted in behavior. The family deals with anger, frustration, and they also have to deal with the neglect of responsibility that the addicted person neglects when they pursue the addictive behavior. There's economic burden, loss of productive time in pursuit of the behavior, and cost for treatment, and job losses as a result of the addiction. Socially, there is stigma related to addictive behaviors. When an individual is known to be addictive or to be overusing a particular behavior, the society shuns on them, and there's a lot of stigma that is related to them. They have trouble dealing with relationships, dealing with their debtors if they are involved in debts as a result of their behavior, and that impacts negatively on their social well-being. Psychologically, there is dependence on the addictive behavior. There may not be physical dependence, but there's psychological dependence on the addictive behavior. And other mental disorders are also associated with the behavior. And these are mental disorders that come as a result of the addiction, or mental disorders that were there before the addiction but were exacerbated by the addictive behavior. Spiritually, addictive behavior brings shame and guilt that causes a feeling of isolation from God, and we can barely have a satisfying relationship with God when we have a behavior of addiction. Treatment is available, and there are so many treatment options that can be pursued to deal with addictive behavior. There's outpatient therapy, where one can get therapy to deal with the addictions and deal with the underlying emotional factors that may have caused or propagated their addictions. It is important for one to identify a person who is qualified to deal with addiction, a person who can help them deal with their addiction productively and properly. Outpatient therapy also include group support, counseling, family support, and individual therapy. Medication can also be used, especially in cases where there are either diagnosed psychological problems that probably are fueling or driving their addictive behavior. There's also inpatient treatment where one can get support within a community of help, especially where one feels that they need a more structured environment to take responsibility for the change that they need to get in their lives. Support groups are also helpful, especially in cases where one has gone through treatment and they meet with their peers to discuss and help each other with coping skill and be able to motivate each other to remain in the path for recovery. Having a behavioral addiction is hard. The stigma of addiction makes it difficult to come clean to friends and families, but going it alone might even be more harder. So if you are struggling with a behavior that you think is addictive, considering what we have discussed, consider talking to at least a few of your friends or people in your circle. Let them know what you are struggling with and how they can come in to help you deal with your situation. Keep in mind that dealing and recovering from addiction usually isn't so simple. Be prepared to also encounter other emotional problems that probably have been driving your addiction, and deal with them conclusively and productively in therapy, even as you get support from your circle, your social circle. Activities like exercises, meditation, hobbies, and even just spending more time with friends and seeing family often relieves stress and boosts your mood and energy. These activities promote the release of mood-enhancing neurotransmitters that can help you rebalance your brain. They provide less intense but more long-lasting reward that can help deal with your addiction problem. Finally, remember that any change begins in the mind. As you come to realize that change is necessary, possible, and is worth it in the end, strengthen your mindset by accepting these facts. And prepare yourself for some difficult days as you work on your recovery. On the days when change is particularly hard, remind yourself on the why you are seeking for that change. Remember what matters to you, and remember that you managing successfully to change that behavior is based on what really matters to you. Having this in mind can help you go through the most difficult times on your recovery journey. This brings us to the end of our sharing today. We believe that you are learning more and more each day as these episodes are brought unto you, and we hope to see you again. Same place, same time next week.